We've done more than 11,000 patients have been treated with our combination of stem cells and rehabilitation. And we've not had any patient who's worsened, deteriorated because of stem cells.
The foundation of the child is strengthened, stem cells. So foundation is good, you can make a big building.
I think we can completely change the world of special needs kids, and these kids have the potential to change the world.
So the parents, be aware and don't let your child and daughters be at home. Come up with them, social interaction, some of the result will come.
It's a pleasure to have you here, and now we are both of us, me and Dr. Nandini, we are open to any questions you have. You are asking the questions as parents of special needs children, children on the autism spectrum and other neurodevelopmental disorders, but in a way you are asking questions on behalf of all parents of special needs children.
My very first concern question is why these medical doctors mostly. Medical doctors are very much against these stem cells.
This is not just in the Maldives, this is everywhere in the world, from the most developed countries of America, England, Australia to, completely, other third world countries and so on, Asia and Africa. Now the reasons are multiple. First, stem cell therapy is a new technology, it's a disruptive technology, right? So when anything new or disruptive comes, it changes what is called the status quo, the establishment. There are already people who are established in doing what they are doing. There are people who are running rehabilitation centers. There are people who are running services. And when they hear that there is something that can actually completely treat or completely cure, there is a subconscious disbelief sometimes or a subconscious fear that the work that they are doing will get affected. If all these children become okay, what will happen to the work they are doing? This is one part of the story. But there is more. The other thing is that stem cell therapy has developed in the East. It is developed in India, China, Japan and Korea. These four countries are the leaders. Most other medical technologies were developed in the West. They started from America or England and Europe. And all of us in Asian and African countries, and Maldives is just like India, we have what I call a colonial hangover. Okay, so anything that comes from the West, we accept blindly. Okay, if the work that we were doing in India had come from America or England, your doctors would accept it blindly. Why? Because it's come with a tag of Harvard, Stanford, Oxford or Cambridge.
Yes,
But because it comes from Asia, okay, they tend to not value it as much. But for historical reasons, for political reasons, and you will be surprised, for religious reasons, stem cell therapy did not develop in the West, because the background is that originally, in 1998, embryonic stem cells were discovered, and in a particular major religious faith, family planning, abortion is not allowed, and so they were against, against the use of embryonic stem cells. And so the president of the United States banned research in that. Now, that is George Bush. But what most people don't realize is that President Obama, as soon as he became president, lifted that ban. Right? So people remember the ban, they don't remember the fact that it was lifted. But this gave the whole field a backseat in the Western countries. So you will not find this developed in America, Canada, Europe, England, etc. So this is the other reason. The third reason is that a lot of the medical work, medical field is actually supported by the big pharma lobby, the drugs, medicals and all that. Now we are not a medicine, and so we do not have the support of the pharmaceutical industry. If there was a drug that was doing what we were doing, it would be the most popular drug in the world. It would be $1 trillion drug, all right? But because we have nothing to do with medicines, this is a procedure. The pharma industry is not behind us, and the whole medical field, whether doctors may not accept it, a lot of it is driven by pharma, right? So there are multiple reasons. One, because it came from the East and not the West. Secondly, because big pharma is not behind us. We are individual doctors doing practice. And the third is because the people who are working in this field feel threatened that their work may suffer. All right. For example, your child was not speaking before and he was taking speech therapy. Now, after stem cells, he starts talking. He no more needs speech therapy. All right. So, do you think a therapist is going to support something which is going to affect their own livelihood or revenue earning potential? So this is the background to it. This is the reason why we have to fight, and we are fighting this every day, even today. Right here, while we do this work, we have to fight this in India. We have to fight this in different countries that we go to. So you're very right. This is. But I believe that in another 5 or 10 years, this will become a standard of care. You know the reason why? Because now America has started doing, in America, Duke University has now started the use of stem cells for autism. And now that it has started in America, okay, now slowly the world is now suddenly saying, well, if it started in America, there must be something to it.
I mean, side effect after doing this stem cell.
So we've done more than 11,000 patients have been treated with our combination of stem cells and rehabilitation. And we've not had any patient who is worsened, deteriorated because of stem cells. All right. So we have a 100% safety track record. We have had no patient who's had an infection and no patient who, because of the stem cells, there has been a deterioration. So safety is given. Okay, we assure you of safety simply because of our track record. Also because of what we do. So there is no surgery involved in our procedure. Okay, what we are doing is we are putting a needle into the pelvic bone, taking out the bone marrow. So it's a needle prick. Okay, there is no cutting, there is no stitch, there is nothing like that. We are taking the child's own cells. We are just separating the stem cells from the rest of the bone marrow. There is no chemical, there is nothing artificial, nothing there. And then we are injecting it through a simple needle into the lower lumbar spinal fluid. So in the whole treatment, there are only 2 needle pricks, and the child's own cells are going back into the child. So if we just think from a simple, elementary common sense point of view, 2 needle pricks cannot do any harm. Also, we are not putting anything artificial. We are putting our own cells. Okay. Now, there are a few minor things that can happen after the procedure. So some children may have a little backache for 2-3 days. Some have a little pain from where we have taken the stem cells. We have some kids who get what is called a spinal headache. Okay, this is a headache that lasts for 2 days. But this happens, during your period of stay here. It never happens once you go back. So, but all these things, whether it's the spinal headache or it is the difficult pain, these are all local, they are transient, they are treatable, and they are reversible. That means that nothing goes wrong with the child. It's just 2 or 3 days of discomfort. So there is nothing dangerous in any of these, side effects. The only side effect of concern is in children who have a history of epilepsy, like children who have fits or convulsions. There is a possibility that these children, in 6% of our children, we saw that they can have in the first 3 months an increase in the incidence. So you understand, in children who have no epilepsy, no risk. But where there is epilepsy, there is a transient possibility that the fits might increase in the first 3 months. So as a treatment, I give you a full personal assurance that no child of ours is going to become worse than what they already are. I mean, that's like a given. That's like a guarantee.
But some countries, they are doing by umbilical cord or something. But here in Mumbai, we are doing this a different way.
Umbilical cord is something which is preserved at birth. So maybe, I don't know if any of you have preserved the umbilical. In Maldives, do they preserve the umbilical cord? Okay, so now in India and many Western countries, at birth, the umbilical cord, which is normally, it is cut, removed, and it is thrown in garbage. Okay, so what companies do is, there are 2 kinds. There is, they can preserve your child's umbilical cord, they can preserve it, and there's an expense involved to it, and they bank it. Now this is saved for your child. So if your child requires it in future, this can be received, and this is the work being done at the Duke University, right? The second is there are some companies that collect these umbilical cords from multiple hospitals, from everybody. Like, Jabi, if there are deliveries, they just go. Instead of it being thrown in the garbage, it is collected. And then they save it from all the things and they package, like they make stem cell, a product, a stem cell product of umbilical cord. Now this is then sold. Okay, so there are two options. One is umbilical cord of your own child if you have preserved, but you have not preserved, so now that is not there. The second is umbilical cord which has been saved from many other children. Have you understood the difference?
Yes, sir.
The first thing is, whenever anything is preserved, the word preserve means you have to add a preservative. Okay, so if you take homemade orange juice, if you take orange, and just give orange, you don't need to preserve it if you are drinking juice. But if you want to package it, you have to preserve it. Now, the preservative for stem cells, there is this one preservative, it is called DMSO. Okay. Now, this particular preservative is harmful and dangerous for the nervous system. Like if you inject it into the spinal fluid, it can cause damage. Of course, before giving it, the preservative is removed. Okay, but you can never remove 100%. There can always be some left. That is why the umbilical cord cells are given IV injection in the hand. They are not injected the way we inject. All right. So the first thing to remember is that those cells have a preservative. Our cells have no preservative. So we are doing fresh. We are taking out, giving it back the same day. No preservatives. That's number one. Number two, because it has to be given intravenously, we give ourselves directly in the spinal fluid. Directly in the spinal fluid. So it goes straight to the brain. Directly where we want it. Here it is given intravenously. So from the arm, it first comes here to the right side of the heart. The right side of the heart sends it to the lungs. Okay. Then from the lungs, it goes to the left side of the heart. And from the left side of the heart, it goes to the brain. Have you understood? That is the way the body works. Now, when it comes to the lungs, research has shown that 70% of the cells get deposited in the lungs. All right. So now we want it in the brain. We don't want these cells in the lungs. And then only 30% of it goes. Then some of it get trapped in the liver. And a small percentage reach the brain. Also, once they reach the brain, there is something called the blood-brain barrier. This is a scientific term. The brain has like a security guard. It's got a protection system. It decides what will come in, what will not come in. So there is a likelihood, not known for sure, that the blood-brain barrier may not let some of the cells enter because they are not your own cells. It'll say these cells look like they are not from my body, so they may not let you enter. Now, we have used umbilical cord cells. We have nothing against umbilical cord cells, but we have used it for COVID patients. So, not in our institute, not in NeuroGen, but I'm also professor of neurosurgery and head of department at the medical college, the government medical college. So, we were the first. I was the first to get permission by the government of India to do stem cells in COVID. And we've done an FDA-approved study for stem cells in COVID patients. Now, there, we inject IV. Why? Because we want it in the lungs. In COVID, the problem is in the lungs. Okay. So I will not use bone marrow for COVID patients. Doesn't make sense. I don't want it to go to the brain. So I use umbilical cord, but where it is required in COVID patients, and we've had excellent results. We've had some really amazing results with COVID. Third thing, the number of cells that we want, are much more because we can take whatever we want from the bone marrow. We have chosen to do bone marrow. Also, you have to understand that this umbilical cord thing is very easy. There are companies that manufacture it. You have to just go, buy it, and a nurse can inject it. I mean, what's the big deal? Here, me and Dr. Nandini, we do the procedure. We go and put it in the bone marrow. We aspirate the stem cells. Then we make it ourselves. We have a laboratory in the operation theatre. Umbilical cord is good, but for select indications where you want it, in the lungs and the rest of the body. It is definitely not good for the brain. We have the world's first scientific paper on stem cell therapy in autism. And I've read all the other papers everybody's published, including the ones from Duke University, China. But almost nobody has got the results that we have. We've got the best clinical results of all the published papers. I don't know what others are doing. If somebody claims to have better results, I don't know. But in medicine, we don't go by what people say. We go by what is published scientifically in peer-reviewed medical journals. that somebody publishes work which shows that umbilical cord results are better than ours, I'd be happy to change. I want our children to get better, whichever way. But so far, nobody's published that. Nobody's published results better than us, documented results. We have clinical results, we have scores, we have PET CT scans that before and after we've actually shown. You people have seen PET scans. You've seen the amazing improvement in your own children's PET scans. Now that PET scan machine is a General Electric machine. It's a GE machine. You know GE, General Electric, they're the guys who make all the aircraft engines and everything else. They have standardized results. You do a PET scan anywhere in the world, you'll get similar kind of results. A machine is telling you that those parts of the brain in your children which were not functioning appropriately, which were hypometabolic, which were inactive, they've got activated. So we have not only in your children you've seen improvements, but the scans are showing improvements. Okay. Now till such time as somebody shows me these results, why should we change? See, we give our children everything, but we don't give them our time. So, and this is something, because we study children who are doing better than others, not doing as well as others. And we have here in this room an amazing example of a parent, okay, who has done, who according to me needs to be a role model, because I learned from him after so many years as to what appropriate parenting should be. Now, this does not mean that other parents don't do as much. It's just that sometimes they don't know. See, if you don't know how to do something, you will not do it. So instead of me, I request you. Because you completely blessed me. I'm just so completely blown away by the way you have organized, the entire schedule of his journey. From then to now, he's improved a lot. But I think stem cell therapy, what we did, we can take credit for a small amount. The big amount of credit is yours. So would you like to share with the parents, what did you do? I mean, what you shared with me, if you can briefly talk to them.
My child is of the 8 years old, so actually I have been trying, since he was 3 years old when he was diagnosed with autism. So from that moment, I've been taking him to 6 or 5 days a week to different therapies continuously without missing any session. Even though it's raining also, I didn't miss any. At that time, I was in Hurle.
You have to cap to them.
At that time, I was in Hurle for my is a in charge. I was in charge. For his betterment or his improvement, I left everything there and I just changed back to Maldives just to take him to the therapies. I just changed to a office job. So I talked with my seniors and I told them that I have these issues and I have this kind of kid, so I need some release from my work. So they said okay. So every day they gave me an early release from 2 p.m. Actually our office finished at 4. So they released me at 2 p.m. so I can take it from daycare to the therapy and again daycare. From daycare they will change his clothes, so again I take him to school. So I kept everything in a schedule. I want him to stay away from the screens. We are working parents, so actually we don't have that much time for the kids. So at that time I have a maid or nanny, so we send back for her. So morning 7:30 we take him to the daycare, so he'll be along with other kids, so he'll be more socializing, he'll be interacting with others. So again, actually these things involve so much money, but still we have to do a bit of sacrifice. Actually at that time I was a very, very heavy smoker.
Okay,
I was really a heavy smoker, 2 to 3 packs per day and I have so much coffee. So if I earn a which much little, so I gave up those habits. So easily I can send him to the best preschool. So everything managed very easily. I kept him in a very strict schedule. Everything is fixed. I don't give him bonus 1 minute also. The time is time. So very, very simple example. his school will finish around 6 p.m. So at that time his dinner will be ready at home. So I take him to home, then he'll get TV time up to 7.
Okay.
He should finish his dinner at 7. That's it. So after 7 we take him to the toilet, brush, bath or anything. Around 7:30 he should be on the bed. Even though it's a weekend also. It's not changed. But sometimes, but very few. And I can count the days he get little bit extra. For example, if there's a special occasion, maybe fireworks or those kind of things. So he get little bit of extra. That's, or else he will not get anything. Even though it is a weekend also, he should follow the rules. Then plus we are also following the same schedule. I mean, it's a combination. You can't make your child follow the schedule unless you are not following.
Exactly.
So you have to follow it. Then only it will work. Not only me, even my wife, she's also doing this sacrifice. So if I am tired, she will do. I mean, it's a partner. Of course. That's why we are called life partners.
Yes,
Exactly.
This is the partnership.
And that's why child has two parents because of that.
Yes. You can't just simply give all the responsibilities to the child, I mean to the mother, and stay out of the house saying, okay, I'm mine. No, that's not it. You should also take something. If you also want to go out, you should stay at home. So that's how it works.
Stem cells are stimulated by exercise, and also the rehabilitation gets directed by the stem cells. So both help each other. So the child needs like a holistic approach or a comprehensive rehabilitation needs to be done. So depending on older child, now we are looking at more skill development. You know how it's a 16, 17, 18, you need to develop skills now to become more independent. So what we do is our therapist will sit with you and set goals for your child. You keep a notebook to see where have you reached. That is one thing. And there's a lot of things that parents can do. I mean, we feel that parents, and especially for a younger child, mother is the best therapist. For an older boy, the father needs to contribute because that bonding is very important. You can guide your child the best. So we can give online therapies also to you, and if you request, they can like once a week, they can guide you. If you need more speech therapy, they can do online speech therapy sessions, or they can see what you are doing online and give you advice. You will get all virtual help from our side. We are invested in the child's development till the child becomes completely independent. That is our commitment.
We've been doing stem cell therapy since 2008, and for till last year we were doing stem cells and neuro rehabilitation. Okay, and we were getting very good results. But in our institution, there is a constant attempt to innovate, to do better, to get better results. It's like your mobile phones. The companies are always trying to get the next model has to be better than the previous one. So in our minds, we were always trying to innovate. What better? So of course, we get better equipment in our lab, and we try to keep improving all of that. That's one part. But then, as we were studying, because see, our commitment is to get our children to get better, okay, with whatever it takes. So then we discovered the usefulness of hyperbaric oxygen, because there was a lot of work on hyperbaric oxygen. It's known as HBOT. We then discovered the benefits of ozone therapy, and then we looked at a whole lot of other therapies that were also possibly beneficial. And then when we studied, and it took us 3 to 4 years to study it. Okay, we visited places where these were being used. We spoke to people who were, pioneers in this therapy, and tried to understand the principles and the values behind this. And then we realized that this could be synergistic. Right? These could sort of be better. And if I had to use a simple example, stem cells are like seeds. Okay, and if you take seeds and you put it in the soil, it depends not only on the seed but also depends on the soil. So if I take the same seeds and I give it to you, and you put it near a river, and if I give it to you and you put it near some desert, dry area, your seeds will grow more, right? Because the soil is more fertile. So the integrative therapies improves the soil, right? So when the soil improves, the seeds are going to be better. So the stem cells are doing the work, but this will improve the soil in which we put them. That is the brain as a whole, the body as a whole, okay? Because the body is all interconnected. The brain is part of the body. We have a body's immune system. We have inflammatory processes. We have infections in different parts of the bodies that can cause problems. So all the treatments we give start balancing out everything. The basic principle and what we have found is that we are getting faster results. I think the same results we were earlier getting after 1 year. The patients who have taken integrative, we are getting at 6 months. And the patients who took it 6 months ago and are coming back, we are finding some very amazing results, particularly with the speech. So we believe that combining this will give us better results overall. That is our general belief. Now, hyperbaric oxygen basically is oxygen which is given under pressure. So right now we are sitting here, we are breathing oxygen at 1 atmosphere oxygen. Okay. Now, when we breathe at one atmosphere, the oxygen when it goes to our blood has got a liquid called plasma. It has got red blood cells and white blood cells. You are aware of that? Okay. Now, the red blood cells have got something called hemoglobin. You've heard that.
Yeah.
So presently in all of us, when we take in oxygen, only the hemoglobin in the red blood cells carries the oxygen everywhere.
Yeah.
Only the hemoglobin in the red blood cells, not the white blood cells. And the entire liquid, that is plasma, has no oxygen. But when you give oxygen under higher pressure, okay, now the oxygen enters the liquid, the plasma. That means the entire liquid is also full of oxygen. And liquid has a deeper penetration. Liquid will go into every little nook and corner and cranny where sometimes even the cells can't go. So overall, there is better oxygenation of the brain and of all the other systems as well. This has a beneficial effect at a cellular level. And in our cells, like our body is made up of organs are made of cells. And the fundamental unit in all of us is a cell. You know what a cell is? A single cell. Now, the battery of the cell is something called mitochondria. It's like your mobile phone has a battery, so our cells have a battery. That's called the mitochondria. It's the energy-giving thing. And hyperbaric oxygen has a direct impact right there on the mitochondria itself. And so you have cells that are more energized, right? So the recovery is better. Ozone therapy is again very interesting. Oxygen is O2, ozone is O3. So it's a more activated form of oxygen, And primarily what it does, it has a very important role as an anti-infective. It destroys all viruses, it destroys fungi, it destroys bacteria. And when we actually give it in different ways. You can breathe it, all right? So then it goes into the lungs and clears up the lungs completely. We also give it through the rectum. So there is gut cleansing. We all know that our children have gut issues, right? So what we need to do is clean the gut as well. So ozone per rectum has an amazing gut cleansing property. So we have been giving that. Then there are of course different ways of giving it. We give it through the ear, and there are other ways in which we can also give it.
The headache, because there is a pressure change. So like when you're traveling in a flight, you can have mainly ear pain. That is one of the major things that happens with HPOT. So if there is a ear block or there is wax in the ear pressure difference changes doesn't happen. Even you and me, we get this ear pain and we have to swallow. Then the ear pressure equalizes.
He was complaining about.
If the child hasn't had proper food to eat, there can be a low sugar which can lead to a headache. So we have to eat properly before going into the HPOT machine, both for ozone also. So before taking ozone also, there has to be good intake of food. Then you take ozone, otherwise there can be hypoglycemia leading to headache. But it could be also, he's saying headache could also be ear pain. So ear, I think he has wax in the ear, no?
Yeah.
Yes, the ENT surgeon has seen. So that wax could also be causing, the ear pain can get transmitted to the head and maybe, being manifested as a headache.
So we do have a social work department. Okay. Interestingly, when we started our organization, We started with the social work department. Now the social work department does address this issue. So when you make an application, then they will consider the income, they will consider everything else, and then they find ways in which together we can somehow, because we believe that every child has a right, the fundamental right to get better, and that money and resources should not come in the way of that. The stem cells, please remember, only fixes the defective hardware. The software will come from what the child is exposed to at home. It will come from the therapies. It will come from and the brain post stem cell is hungry for picking up information. Like when we were born, our brains were empty. Our first language. How did we learn our first language? Nobody taught us. We learned it by what we heard. So, like the newborn brain is hungry for information and sucks information. You remember that blue stuff, that blue part of the brain on the PET CT scans?
Yeah.
That was inactive brain. The stem cells have activated it. So literally, our children neurobiologically are born again. This is like their second neurological birth. So if it is not you, you pick it up from the maid, from the helper, from the therapist, from television, from YouTube, okay, from mobile phones. This brain is going to get programmed, right, irrespective of who's around. Now the choice is, do we want to do the programming or do we want it to be random programming? Do we want the brain to be programmed from what's on television or what's on YouTube, okay? Or do we want to be in control? So what you did is you've taken charge of the programming. Therapy centers, at home, and so you are now in control. And this is extremely important because these children, we have this lovely child from London, England, who after the first stem cell therapy center, he was born to a single, the mother was a single mother looking after him, and she was very religious, Islamic, and she, once for something gave him a YouTube video of the Holy Quran, okay. In 6 months' time post stem cell, this child can recite the entire Holy Quran, the entire Quran by heart.
He's in Maldives also.
Yeah, there's a child like that, mother.
Yes. He learned the Quran through listening. Like in between the Maghrib and Isha, there's a national television. The Quran has been telecasted. Yeah, if I'm not wrong, you might agree that. So he learned that Quran through listening, that visually, that telecasting through the television. So he's the by heart the Quran.
Yeah, but this child could not speak. I want to understand. I'm showing this for a reason. The mother, there was no father. The mother is alone. Okay, and she happened to give him. Because just happened to give him YouTube, whatever, told him to watch this, and he picked up. He came back here 6 months later for a second shot. A child who could not speak recites the entire Holy Quran. Okay, especially child. That is so amazing. So much like your son who does amazing mathematics. You have to listen to his son is doing the most amazing mathematics. You say this 12 raised to the square 6, and before I can do it on my face, he's already come up with the answer. Do you know that? You have to see. He's done the most amazing math. The most amazing mathematics. It's so brilliant. So these kids have, but that is because, I'll tell you the reason. I was having a conversation with him. He realized that, he hasn't told him anything, but he actually, his son loves books. So he made an entire library for him. He bought books for the child, put books there, ensured his training, ensured his programming, right? We had another child from one of our cities, Bangalore, who, again, that child, who could not speak is now doing engineering level mathematics. Engineering level. But that is because the mother identified this child has special skill in maths, got her a maths tutor. Okay? And today this child is doing beyond, she's just 7-8 years old, but can do maths of her engineering level. I remember I showed you that.
Similarly, one child who came from US. So again, the child is still to start speaking, but he's less than 6 years old, and he can do mathematics of 9 years plus. 9 years plus, and he can just hear and he can write it. He wrote beautiful, like, where are you going? I'm going to NeuroGen. Less than 6 years, he's writing this. What are you going for? I'm going for stem cell therapy.
Wow.
So that is after the stem cell therapy, parents said, we have come to show you just this, that how much our child has improved after stem cell treatment.
Last year, 2019, we had a stem cell. So she has a lot of development. She has a lot of skill like singing. She loves to host in the show. She has her own choreographical dancing videos. The thing is, slowly, gradually, it's come to improving. Then last year, she asked me, mom, do you have money for coming for second show? I won't go for review. So she's thinking. So the last year, they have given a special diet program. She continuously followed that diet program. Today, we have seen the result of that diet program. I will give a message to the old parents. First, they have to be a positive mind.
Exactly. Very
If there's no positive mind, please don't do this. Aisa mat kar. Seriously. Then second one is, it won't come overnight. The result may not come in overnight. It takes times, it takes a minute, it takes seconds, it takes years, but don't lose your hope. One day you will feel proud. That's it.
Yes.
I want to add something else. That, the first thing is you have to accept. Then the second thing is that you have to let know or educate the people who are working with you, the colleagues and everyone. I mean, you don't have to be shy that you are having someone. That's what I did. I told all of my friends, even my seniors, that okay, look here, I have this kind of guy I have to take care. I have to take him to therapies, and I have this kind of difficulties. Then everything I told him very frankly. Then that's why it got me a bit of easy. They supported me for these kind of things. So that's how I manage him to take school or everything.
The solution to the problem which we are facing as families, first thing is acceptance. I think this is crucial. Okay, once we accept that our child is different, not less than. Okay, we sometimes, when we have a special needs child, we feel our child is less than other children. Okay, no, our child is different. Because there are some things they can do like other. We use the word neurotypical. We don't use the word normal because according to us all are normal. Okay, but there is neurotypical is what we all are. So there are some things they can do as neurotypical. There are some things they cannot do, but there are some things they do better. Like his son does the most amazing math that I cannot do. Okay, I cannot do it. It's impossible. So there are many things in which they are better. And we've had several kids. We have kids who could not speak who are now speaking in 8 languages. We have kids who are amazing with chemicals. There's one kid who's actually set up a huge chemical factory and making 40,000 liters of a particular chemical after did the stem cell, and he improved a little, and he just learned how to mix chemicals and started a factory of his own. So first is our children are different. They are not less than. Step one. Then identify treatments which are safe. First thing is safety and effective. Okay. We listen to everybody. Like he said, I went to all the doctors, neurologists, rehabilitation centers, but finally, he trusted his instinct. Okay, now the parental instinct is never wrong. Let me tell you one thing. For our children, we have a parental, instinct. Is this right or is this wrong? And we should trust that. Okay? We should always trust that. And it's not stem cell or not stem cell. There are so many other treatments, which are available. But before treatment, we should ask ourselves, does our child need this treatment? Because every child is different. Not every child needs, every therapy. So then one must read and research, like what many of you have done. We must read and research, and we must research both sides. We must research what is good, what is, risk factors, safety. We must, because we are entrusting the lives of our children to somebody. Okay, so we must research properly, thoroughly, not go by what people are representing, but by what is underlying that. Because very often people always present a good side of their work, but you have to see both sides. Then choose the treatment that you believe in. Right? Now stem cell therapy is one such treatment, because this treatment fundamentally at the root cause corrects the damage in the brain. So it makes all the other therapies more effective. So what we are doing is we are fixing the damage. Now, in a very simple way, just 2 needle pricks in a very safe way, and in a way that is definitely giving us results, as we've seen over here. Stem cell therapy is one small part. It is fixing the damage. The real work starts after that. What you have to do is you have to forget everything from the past. Whatever you have been told, forget it. Okay? Because you were told everything with the belief that your children cannot be treated, they cannot be cured, that autism is not reversible. The entire medical structure and all the advice given is based on that. We are correcting the fundamental damage, right? So we have to forget that and now look at our children with complete new eyes, with new lenses. My message to all the fathers is we need to give our children time. Okay? And these children like a schedule. Actually, these children like a schedule. Initially they resisted. But once you put a schedule in their life, you notice they stick to that schedule. So even as fathers, if you could give a fixed time, you can decide, okay, 6 to 7 is my time, with my child. Then the child will start looking forward to that. And now you become the person who codes, software coding. I mean, you're going to be, now again, I'm talking everything post-stem cell. The brain needs to be coded, it needs to be programmed. And then, now the child, you can code the way you want it. And not let him get programmed from the digital media and from the world outside. So if we did this, I'm sure, like we have seen in our children already, we can have amazing improvements. Their behavioral issues will be resolved. Their speech, gets back. They can get back to normal schools. Your child is in the 2nd grade and you just told me he's on the highest level of the entire grade, right? The child is so good that he has to be, scored differently. So he's better than all the others. Now this was not always so. This is because of a combination of whatever little contribution we did by fixing the brain damage, with all the hard work that has gone in. But the planned, scheduled hard work. See, we can do hard work, but it has to be to a plan. It has to be structured, and that makes life a little easy for us as well. Once there's a structure, it's initially difficult because we are so used to an unstructured life. So when a structure comes in, initially it's difficult, but then eventually it's good for everyone. And when you put a structure, you will find you have more time for yourself. Isn't that true? When you have a structure, you have more time for yourself. You have more quality time for yourself. You have more quality time, with you and the rest of the family. Because there's the mother, there's other children. We sometimes forget that if you have other children, they need attention too. They need your time as well. So when you have a structure, you actually give more time to everyone. So, and this is something I've learned from, parents like you. I mean, we've actually learned that because as we keep looking at all our kids who are doing well and who are not doing so well or who are doing brilliantly. And these are the common factors. First, all the parents, where the kids have done well, acceptance. I think that's the key. That our child is different, not less than. That we have to completely take that away. Our child is different, not less than. Okay? And after post-stem cell, devote time and have a structure and a schedule. Okay. Third, identify what is special about the child, and then invest in that in training. Like he made a library for his child. Today, why is he excelling? Because he made an entire library. Okay. Normally when you have a special needs child, you don't go about making a library room for the child. They did that, right? That accounts for the success. I think we can completely change the world of special needs kids. The message that we need to give everybody is that the effects of autism can be reversed. Okay, autism is not something, people look at autism, when the first diagnosis is made, people get frightened. There is fear of autism, like, it is this some kind of diagnosis. No, we have to get over that. These are special children, right? Like I said, there are some things which are as neurotypical, something else, but something more. Identify that more, okay, and then cultivate that into an education and vocation. And these kids have the potential to change the world. Einstein had, attention. Albert Einstein had, some degree of autism.
It's a great example.
Some of the billionaires today have had some amount of attention deficit disorder or spectrum, and they have changed the world. So once you realize that our children have the potential to change the world, and they do, I'm not talking hypothetically, I'm talking from historically, from real life, and that what you do, please understand, stem cells can't do that.
Yeah.
Stem cells can only fix the damage. That blue you saw on the PET scan, we can make it green. That's what we can do. We can repair the damage. It's what you do afterwards.
So basically, the foundation of the child is strengthened with stem cells. So foundation is good. You can make a big building over it. So you can challenge the child. You can really push the envelope and stretch your child. So after stem cell therapy, in fact, you should feel that your child can do a lot more and keep trying rather than doing just the basic thing. So let his potential come out and build on it. So this foundation is very important. We find that, as in Daniel's case, after the first 2 treatments, between second and third he has flourished a lot. So that push, that strength is so important.
I think at that time, the most amazing increase comes to my child. It's 100% change.
Yes, exactly.
Those days, up to stem cell therapy, it is very difficult to even come out with my child. He has to do anything. He can do. I also cannot control even. After stem cell therapy, I also and my wife also and we were relatives. All the relatives he accepted. He walks with them and even he visit to other family members and start talking also. He just behave like a normal child. He is very good now.
Very good.
Yeah. Even people can't recognize.
He corrects his younger brother, right?
Yes, he corrects.
Because he's more naughty, the younger one.
He and his son is while walking the road after stem cell therapy. He shared me that experience. It was very actually funny. Then he said, actually your son is 17 years old. He said, Daddy, how beautiful that girl is. No, he said, seriously, that's a good level. That means the thinking level is too different.
And when I told him, okay, now you are, good boy now, your younger brother is a bad boy. Yes, he's very naughty and he talks so well. He's so, quietened and, very mature.
Very mature,
You
yeah.
can't make out that
No, people cannot make out he is a special needs child. Yeah. Very.
Considering his age,
It helps.
he came to us 2 years back. Was it 2019? So
18
he
years.
was 15, 18. So he was 14 at that time. So considering his age, still he's done so well.
So-
Similar with Aisha.
Yes, now it's even my daughter, she can manage clothing, sleeping, and she's adult level, those kind of things coming. I used to change. So she can pray alone. She know how to pray. All these things she learned from she's now starting memorizing Quran. Now we have complete 2-3 chapters. She started, but very slowly. The problem is slow in handwriting. Yeah. But we have to keep on trying, always trying.
She makes her own decisions.
There are a lot of positive results. I can't mention all these in such a small time. There are a lot of positive results, but still we can do more.
Yes, of course. So
Yes.
there's always scope for improvement, even in us.
And then the most concern is, according to Maldives school system, this year is the last year. We have no alternative chances. I mean, vocational programs. Such vocational program was there. Maldives, lot of alternative program is there. But special child like us, there is no such programs in Maldives. It's a very big concern in future. I don't know what we are going to do, but we can do something if there is.
Yeah, of course. There will be a
We will find out.
There's a
This is the way,
You'll find
that's
a
a
way.
good saying.
Find a way. You'll create it.
Yeah.
And you said you were the
We will.
5th person
We
to
will.
register in the. So you are pioneers
Yes,
in
yes,
treatment
yes.
of adult children.
Some of the greatest people in the world never graduated from college.
Yes.
Whether it was Bill Gates or Steve Jobs, they didn't graduate from college. Okay,
No.
including Einstein, I think so. But they changed the world. So we have to, not get them to adapt to our normal. We have to adapt to their normal. Okay, whatever it is. And education is a process. And yes, school and college has an important role. But education happens in life as well. And sometimes it happens at work and through work and in the middle of things. So we can identify, some special skill sets and then, redirect their life according to that. That is what is important.
Yeah.
These children, because they are detached from what I call the real world, so then this becomes their world, right? And you have to do, what he just described, fixed time. They get half an hour for TV only, half an hour for. If you put that structure, then they stick to that structure. But what we do, I'll tell you, sometimes as a convenience, because we can't handle the kids, it's difficult. You just give them to sometimes make our life a little easy. You understand? I mean,
Yes.
I buy different kinds of books that he needs to use his brain. And for example, maze, that he needs to draw through the maze, or maybe some pictures he has to do with dot to dot, dot to dot. It will come with number 1, 2, 3 like that. So you have to do something like that if he is interested with those things. So he will be focusing on that at that time. You can give foods or those things. Once he is addicted to the phone or things, it will be very difficult. Still I'm struggling. I'm struggling.
And this is so for all children. Can I suggest something?
Yes.
If you don't want your child to use the phone, do not show the phone to him. Don't use the phone in front of him.
It's very good.
That's most important.
like she said, if you're using the phone all the time, how do you stop him from using it?
So in front of him, no phone, time to him only. Give him time, give him alternatives. Like now what parent says, I've removed the phone completely except for eating. And so eating then goes on for 1 hour. Because he doesn't want to use the phone.
Even our seniors will not accept, no teachers will accept. Even society is, there's no autism at all.
Yes.
Nobody knows it. So, firstly, I went for the pediatric. I thought he was born with a deaf. He's not.
Very often.
He's not acted at all. Even we are shouting also, no cares. So I went with the pediatric. He said no. He was born. No, we thought he is not a deaf. Then I traveled everywhere like him. For all the my annual leaves I spent with him, going everywhere, but doesn't know about how to do it. Then even therapies, whatever available, then finally it comes. Know that. So while up, can't explain actually what we are struggling, because even our relatives doesn't know. Then some relatives were shouting, don't do that, don't do that. Then even we are, that is my child. Even my younger brother doesn't know how to treat. But our relatives, our friends are not accepting. They are thinking that he is come from other world. So that is very difficult part.
First of all, identify what the specialty is. Then and try to read the magazine, YouTube, whatever source of information is there, and compare to your child what your child or daughter is having, and read those articles. And definitely they will give some at least knowledge and aware the people. Please don't let your child or daughters die like this.
Right.
Self-assessment.
It's very, very important to come up and ask the people. Don't hide your son and daughters in your garpe matrakai. So the parents, be aware and don't let your child and daughters be at home. Come up with them, social interaction, play with the ground, go to the beach and swim, everything do. Somehow the result will come.
Alright, so I'd just like to thank all of you.
Yes.
On behalf of the NeuroGen Brain and Spine Institute, myself, Dr. Nandini, our entire team, thank you for taking this time out. I just want you to know that, this time that we have shared together, this will make a huge difference to parents who are struggling out there. Because there are so many parents who, one of the worst things is to not have a clear direction. When there's no hope, when there is no direction, and you keep going from pillar to post, there is nothing worse than that, especially when it concerns your child. For ourselves, we can take anything, okay? But for a child, when, you know, our minds think, well, you know, science is developing so much, we are sending people to, trillion people sending to Mars and Moon and rockets and so much science. Why can't my child be helped? All right. So the first thing, you know, the message to everybody is that today, medical science and research and technology has tools available that can help our child, you know, and stem cell therapy is one such tool. There are many such tools, you know, our integrative therapy, hyperbaric, ozone, many of these things, and rehabilitation. Rehabilitation is very, very important. These things are available wherever you are. They are available in the Maldives, and if not, maybe parents such as yourself should get together and make it available. In many countries, we have seen actually parents are the ones who've taken the initiative and set up rehabilitation centers, set up treatment facilities. So maybe, you know, you could take the lead and do something like that. So, but the message that, you know, other parents who will see this will be one of hope. That yes, you know, they are seeing parents who have been, you know, 16, 18 years down the road, and they say, well, if, you know, they've seen that period. They are seeing parents, they are hearing parents whose children are just diagnosed, and parents whose children were diagnosed, had a problem, and now are improving. You know, what every parent or child with autism wants is that the child should get back speech. And we have real life examples of how speech has come back, that they should get educated. And we have real life examples of how that is happening. But this comes with hope. This comes with, you know, knowledge, knowing what is there. This comes with clarity and a plan of action. This comes with making appropriate choices of the right treatments that are suitable to our child. No two children are different. What may be suitable for your child may not be suitable for his child. So we have to take what is best for our child. According to me, all treatments have a certain role to play. And we must look at all treatments, study the science, study the publications. And then what was finally discussed here, have a schedule, have a plan, work hard, give your child time. And with that, we can reverse autism. So thank you so much. Thank you for being here.